According to the World Health Organization, it's an article that was published in 2020. Untreated dental caries or tooth decay in permanent teeth is the most common health condition according to the global burden of disease. Okay. This goes untreated in a vast majority of the population. In fact, tooth decay increases over a lifetime. Okay. If you look at this bar graph from ages 2 to 5, we're at 28%, and it steadily inclines when it tops off between 40 and 59 years old at 95% of the population has some form of decay. Okay. The other problem that we're facing is that only 40% of the population goes to the dentist. 60% of the people remain untreated and even undiagnosed in most cases. So a lot of people are walking around with decay without knowing that they have it. Okay. What are the reasons why people don't go to the dentist? Major reason is obviously fear. People are afraid of the dentist. Finances. It's expensive to go to the dentist. And when people generally come, they're coming late in the game when there's pain, and that requires very expensive procedures. And number 3, mistrust, right? So when you go to the dentist finds a cavity, but then it doesn't hurt. And the patient says, well, why should I do it? It's not hurting me now. Let's just wait. So a lot of the patients take this wait and see approach, which ultimately ends up in a pain and more issues later. Okay. But what if we had a solution that would eliminate all injections, all drilling, would be fairly inexpensive to do? Would that encourage people to come? We feel that that would be a very big shift in the way we practice dentistry today. So this is what people hate. And I wanted to put up this picture just to remind people of what we don't like. Okay. Injections, drilling, children going to a pediatric dentist and they have to papoose them because they're afraid that the child will move while being worked on. Scary. So let's talk about the top secret. Let me tell you what it is. We have 2 materials in dentistry that are kind of married to each other. I call it a marriage made in heaven. We have one material called Silver Diamine Flouride plus glass ionomer make up what's called a SMART filling. SMART stands for Silver Modified Atraumatic Restorative Treatment. Now, let me first kind of go through with you how the decay process works, and then I will kind of break down and explain to you how the SMART filling then applies to what we're talking about. So the tooth is made up of mostly minerals, okay? 95% of the tooth is minerals. Calcium, phosphate, magnesium make up most of the tooth, the makeup. Okay, 4% is water, 1% is protein, but the main core of the tooth is minerals in the tooth. Let's talk about how the actual mineral, the tooth itself, becomes cavitated, how we get cavities. So the tooth, a healthy tooth generally gets plaque or bacteria that comes and lands on the tooth. That's called the biofilm. That's the plaque, okay? As the plaque sits there and houses on the tooth, it starts to emit acid. This acid actually starts to demineralize the mineral of the enamel. And this causes a cavity or a caries process, okay? This is what we call the process of cavitation in the tooth. The international, see the sign that says ICDAS? This is the International Caries Detection and Assessment System. It's designed and accepted throughout the world of determining what the assessment of decay is and what levels of decay we have. And this is the progression of decay from 0, where it's a perfectly good tooth, to where it's a beginning, early inception of decay, what we call incipient decay, furthermore, moderate lesions, and then extensive lesions. In fact, it looks kind of not terrible here, but if you look at the x-rays, this tooth is about to need a root canal. Okay. So let me kind of give you a picture of how the acid from the bacteria penetrates into the mineral of the tooth and starts to break down the actual enamel, and further breaks down the dentin. So let's all close our eyes right now and picture ourselves on a beautiful sandy beach in Mexico with water coming right under our feet. Okay? Picture it. Now open your eyes and let me explain something to you. So pretend the water is the acid of the bacteria. Your feet are the bacteria, and you're standing on the sand. The sand is the tooth, it's the mineral. As the acid from the bacteria starts to penetrate into the sand, slowly the feet start to settle down, like go in deeper and deeper and deeper and deeper. As the acid eats away through the mineral of the tooth, as water eats away, kind of goes through the sand, the feet start to sink. And that is the process of cavitation. That's how teeth become cavitated, or cavities, or caries, as people know it, or decay is formed. Okay. So let's look at the fact sheet. Okay. Cavitation is not always present with demineralization, meaning what? Your feet can be still standing on pretty tight sand, but acid is already seeping through. So the disease process is beginning. However, it's not formed a hole in the tooth just yet. Cavitation will follow demineralization, okay? But, however, demineralized tooth structure can remineralize, heal itself with biochemical intervention. Antimicrobial therapy, which is the silver diamine fluoride, fluoridation, and chemical bonding fillings, okay? So let's further talk about the classification of decay and what happens, okay? So ICDAS0 is a perfectly kind of a healthy tooth, or a perfectly restored tooth where there's nothing going on, okay? Initial disease is starting right here and right here, okay? This is what we call initial caries formation. And if you look at the x-ray, you can kind of see it in between. Then you have more moderate caries. This white lesion is the beginning of demineralization of the actual mineral, and then eventually becomes worse. And then we get to stage 5 and 6, and these are already pretty bad decayed teeth, where it's in the latter 1/3 of the dentin, very close to the nerve. This particular tooth may require a root canal. However, we are talking about this area right here is where we would want to get our patients so we could treat them and make sure that we protect their teeth from getting into this kind of a problem. That's something that we have to now drill into. So let's now talk about the solution, the silver diamine fluoride plus the glass ionomer, the smart filling, okay? We're going to start with the silver diamine fluoride therapy, okay? It arrests and prevents decay, okay? It desensitizes the tooth. In 2014, FDA approved it as a desensitizing agent. In 2016, FDA awarded breakthrough therapy status as a commitment for approval of SDF as a drug to treat cavities, caries. Huge, very, very important 2016 breakthrough, okay? The reason why I have this picture, if you look closely at the picture, all we have here is a few different things. We have the SDF, we have the dampen dish, we have a micro brush, we have a 2x2, we have a cotton roll, we have a super floss. However, what you don't see here is an anesthetic syringe. You don't see any needles, and you don't see a drill. Why? Because it isn't necessary to do this therapy. Furthermore, the United States Department of Health and Human Services published a bunch of research on it. Um, UCSF adopted a protocol for caries control. UCSF is one of the major universities, University of California, San Francisco, has a protocol on caries arrest. This medicament has been used in Japan for over 80 years, but not only Japan, several other countries in the world, and has proven to be extremely effective. Now, what is SDF made of? Okay, primarily 25% of SDF is silver, 8% is ammonia, which is the solvent, and 5% of it is fluoride. The rest is water. This is what the SDF looks like in the United States. This is what SDF looks like in Japan. Okay. Another fantastic and interesting side effect of SDF, okay, is what we call the zombie effect. Once the bacteria reacts with the silver annihilates and kills the bacteria. The dead bugs that are killed by the silver stay in the tooth and kill the living bacteria. And this we call the zombie effect. So this thing keeps on working and killing other bacteria as even kind of what we call post-mortem, right? We get rid of the bugs initially, and the bugs that are there, the zombie effect keeps on acting and keeps on actually killing the bacteria that's alive. So it works consistently and continuously. Now, the next phase, I wanted to kind of give you a little introduction and a little review of how the tooth look. Most of the people know, who go to the dentist, know what this is, but I kind of want to expand on how a tooth looks and what happens with silver diamine as the tooth structure, as far as tooth structure is concerned. So the tooth has three major layers: enamel, dentin, and the nerve. Okay, the enamel is the strongest mineral in the tooth. The underlying material is the dentin. And if you look here, you see these little dark black lines. These are the dentinal tubules. Okay. This is a enlarged picture, microscopic picture of the dentinal tubules. The green picture is the bacteria that's actually infiltrated the tubules. Okay, this is when the tooth is already cavitated, meaning the acids ate through the enamel, hit the dentin, and now is making its way to the nerve. This is after SDF was applied. Everything that's turned red is dead bacteria. Okay. One of the most fantastic things that happens with SDF is the silver penetrating into the dentinal tubules chases the bacteria. As it chases the bacteria, it hardens and becomes essentially like silver wires inside the dentinal tubules, effectively serving like rebar as support for the tooth. In fact, SDF treated dentin is twice as hard as healthy dentin because of this rebar effect. So if you guys are familiar with how construction works and rebar works and how foundation works, that is how we actually reinforce buildings and structures and walls through rebar. This effectively does the same thing in our dentin. The other thing that we should not forget is also SDF does contain a lot of fluoride in it. And in fact, it has 6 times more fluoride than regular fluoride varnish. Okay. So not only do we arrest the decay with this medication, but we also, with the fluoride, remineralize the tooth with this medication. So it's a pretty amazing way to go. And I gotta get to the but. There's always a but in every fantastic discovery and every fantastic thing, and we gotta just talk about it and know what it is right away. So the problem that we have with SDF, and one of the side effects, is that when it's working, it starts to turn the cavity black. Okay. So this is the only side effect that we have with it. Okay. As far as silver, as far as allergies, people are allergic to silver because it's a topical application. This is extremely rare. We've been applying SDF in our practice for over 2 years. We have yet to have anybody react to have a silver allergy in our practice. Okay. However, you do not want to do this procedure yourself because it's extremely operator sensitive. Okay. If you are not careful, you can get, if you get it on your lip or on your skin or on your gums, it will turn it black. However, the black will fade over a few weeks' time, like 2 to 3 weeks' time. But who wants to come out of an office or who wants to walk around with a black lip for even a week or even a day? Okay. So this is the process. I will show you right now. We'll take you step by step what happens when we're using SDF. So this is a tooth cavity treated with SDF. This is the SDF that's now working. You see how the cavity has turned black right here? Okay. And if we don't want this black in the tooth, we can then place a white filling on the tooth, and that's the glass ionomer. That is the next portion of our marriage, the glass ionomer restoration. Kristen, do we have any questions before I start about on glass ionomer about SDF?
Yes, you must have been reading.
Somebody was calling. As I was talking, somebody was calling me. I thought it was people trying to question me. So I had a call in my house. I didn't know if anybody could directly reach me, but.
Well, hey, whoever was calling, they were able to submit a message through. So here's a question we do have. Does the SDF cause the tooth to be black forever?
Actually not. So what happens is if the SDF, okay, this area here, the cavity does become black and stays black, okay? That essentially means that it's working. SDF has to be reapplied every 6 months to make sure that there is no progression. So you actually want it to become black. However, the way we counterbalance that problem is we would apply glass ionomer to the top of it, and effectively, as this picture shows, it would then cover it and look completely white like a normal tooth. So the fact that it's black, I mean, we're not going to do aesthetic areas with SDF necessarily, but aesthetic areas in the front can be then covered. Even if you're doing SDF, you subsequently can do composite fillings on top or glass ionomer fillings on top to cover the blackness of the actual SDF. The beauty, again, of the process is you, however, don't have to drill the tooth.
Right, exactly. And you mentioned too, you said that this is something that does need to be kept up with every 6 months, you said?
Yes. SDF should be reapplied every 6 months in order to make sure that it's working at its most efficacious level.
Got it. Perfect. Okay. And is this something that like I could ask my dentist for? Like they'll know what it is if I bring it up to them?
So the product is fairly new. As I showed you, it was FDA approved in 2014 in the United States. In 2016 was approved for caries rest as far as a breakthrough therapy. So look, people know about it. The younger dentists in the dental schools actually are taught SDF to some extent, not very heavily. The older dentists, guys who are more like me, who graduated a long time ago, this is not so well known among us. Okay, so I had to dig deep and do a lot of research and reading and studying in order to discover and learn about it. And so they may know about it, they may not feel comfortable about it. There's still this terrible association. Well, your tooth will turn black, don't do it, we're not sure. So I think a lot of people, even though they may know about it, may not be very comfortable with it because they just don't understand the efficaciousness of it quite yet.
Mm-hmm. And that's a great answer. Thank you so much, Dr. Zach. And anybody else who has comments, please keep sending them in. And Stephen, Robin, thank you so much for your comment. We're really excited to be able to share this with you all today. So if you do have any more questions, please keep them coming. And you can always visit our website too, zacdental.com. Pretty easy to remember. And I think that's all the questions we have for now. So I'll pop back in whenever we have some more. Thanks.
Perfect, perfect. Hopefully, if somebody calls me next time, I'll try to pick up my phone and answer their questions. I think they're trying to go around you. So let's continue with glass ionomer, okay? And this is the second portion of the restoration that we feel actually makes this restoration something that's very positive and very useful for people, because obviously a lot of people will not want to walk around with black teeth. And now we have a solution how to make them tooth colored, and we can continue to do this and still not have to use a drill and still not have to numb the patient. So let's continue on our journey. Glass ionomer, okay? It is a fantastic material. Okay, number one, best thing that happens with glass ionomer is biochemically bonds to the tooth through an ion exchange fusion layer. Okay, meaning the actual glass ionomer fuses with the tooth, and on a slide level, on a microscopic level, it looks like it becomes part of the tooth. Okay, it creates a permanent seal that is superior to the micromechanical seals of composite bondings, of like the white fillings that we're using, okay, which is what most dentists are using today. It also, because it creates such a complete seal, it isolates the remaining bacteria from its food source. So it blocks the carbohydrates, which is what bacteria feeds off of. That's why we always hear, don't eat sugar. After you eat some sugar, go brush your teeth. Well, carbohydrates are in a lot of different elements of our diet. We're not going to be brushing our teeth for every 5 minutes every time we eat, number one. Number two, it stays in the saliva for hours and hours and hours at times. So if there is bacteria on the teeth, carbohydrates are always around. Well, what happens is the glass ionomer creates a perfect seal and thus suffocates in essentially the bacteria. The bacteria has nothing to feed off of, and it just dies. Okay. And again, it does not require drilling because it doesn't require any micromechanical bonding. It just interacts biochemically with the tooth and blends with the tooth surface. Okay. The next fantastic thing about glass ionomer, okay, is number one, glass ionomer has fluoride, so it acts as a natural remineralizer for the tooth. Okay. However, once the fluoride is depleted from the glass ionomer, it becomes like a reservoir for future fluoride that comes in. So let's say you have glass ionomer that's solely depleted. However, you're drinking tap water that's fluoridated, or you're using fluoride rinses. That essentially will fill in, will react with a glass ionomer and fluoridate the glass ionomer, and it penetrates in the tooth. So there is a constant level of remineralization. In 2 years, it essentially becomes as part of it. The longer it stays in the mouth, the stronger it becomes. Okay. So this is our smart filling. No drills, no injections, silver modified atraumatic technique. The marriage that's made in heaven. Now, let me tell you, we're coming to the end of our presentation. I want to talk to you about one other technique that's important called the atraumatic restorative technique. It's essentially a cousin of the SMART technique. So we have SMART and we have ART. So in some instances, when there is just recession of the gums and there is what we call abfraction or abrasion by the gum line that potentially could be sensitive, sometimes it starts to become discolored, and it's not infected dentin, which is the dentin that's soft and needs to be used with SDF. It's an affected dentin, okay? where we don't have to treat it with SDF because there's nothing active happening. We can just place glass ionomer on it in order to cover the area, desensitize the area, and protect the tooth. Also, aesthetically, it looks very, very nice in that area as well. Okay. So, Kristen, this is the dental industry's biggest secret.
We love to hear it. We love to hear it. And thank you so much, Dr. Zach, for going through all of that, because I know for myself and for other people watching that some people have never heard of this before at all. So it's really impactful to hear everything coming from you. And I do know we have a few more questions coming through. So
So let me just quickly say before I take further questions, we
perfect.
feel, and the reason why we're so passionate about this product, okay, and this bouquet of products, okay, this SDF and glass ionomer, it can help a lot of people that naturally are afraid to go for various reasons and like to put it off. It will allow people to actually kind of become more preventative with their healthcare. Okay. They will not be so worried. They will not be constantly afraid of utilizing dentistry. And I think that change, that shift, and will become kind of a better, more like easier for the patient to accept coming to the dentist and be regular and think in terms of prevention versus think in terms of intervention and drilling and surgeries and things like that. So I think if we can get people to kind of be more proactive with their teeth and be preventative in the treatment, I think it'll go a long way in helping people become healthier as far as dentistry and their teeth are concerned.
Absolutely. Absolutely.
Okay, I am ready to take all the questions you got.
All right. Well, I will hit you with them. So, and before we start too, just to confirm, the silver diamine and the glass ionomer, they don't require any kind of invasive drilling or injections. I just want to make sure we drive that home.
Yeah, no. That's exactly the whole point of it. That's why I showed that slide. Let me go back to my slide, my setup, actually, the way that the tray is set up. This is the entire setup. Okay, there is no anesthetic, there's no syringes. We have a micro brush. We drop a little drop of SDF in here, use the micro brush, put it on the tooth. It's not that simple as far as delivery of it because you got to be very, very careful. It stains, things like that. But as far as actually having to drill or having to numb, absolutely unnecessary. In fact, yesterday I worked on my own 9-year-old son who has some dental problems, and I applied SDF to several of his teeth because he has cavities. And he was a trooper. He loved it. And I wish I could have taken some pictures. I have some pictures. I haven't uploaded them. But maybe we'll put them on our website, and people, when they visit, I'll show them the pictures of my kid.
Yeah, absolutely. And speaking of like your son too, so is SDF available for anyone, any cavity size?
So that's a very good question, Kristen. Remember when I was talking about the actual international caries detection and assessment, this thing system?
Yes.
If somebody is at the level of ICDAS 6, right? This is already past SDF, okay, and glass ionomer. This is already probably most likely going to need not only a crown, not only a filling and a crown, but possibly even a root canal. What we're trying to intercept is this area right here, okay? The initial and the moderate. Maybe in some cases, if we're lucky, we can do beginning advanced, okay? ICDAS 5, okay? This is where we're working on. In fact, ICDAS 0 is a completely healthy tooth. This tooth also should be protected because obviously you don't want it to start going into the disease. So everything from here on to here is SDF, which is probably the highest percentage of all the problems, okay? This potentially may be treated with SDF and glass ionomer. However, this is already too late. Okay. But look, that's kind of a lot of different things we can do.
Mm-hmm. Yeah, that's a great answer. And so are these treatments specifically, are they covered by dental insurance?
Sometimes it is, sometimes it isn't. Some insurances cover it partially. Some insurances may cover the SDF, not the filling. Every insurance is different. So for this, unfortunately, one thing I am not is a huge expert on insurance. I am an expert on dental, but not insurance.
All right. Well, hey, that's what we're here for, the dental knowledge. And so Dr. Zach too, would you be able to talk about like the different locations that you have and where
Yes,
you're located?
sure. So we have 12 locations. We span all the way from Santa Barbara down to San Diego. We have two offices in San Diego, an office in Temecula. We have an office in San Dimas, in Downey, Long Beach, Whittier, Valencia, Simi Valley, Agoura Hills, city of Ventura, and Santa Barbara. Not sure if I'm forgetting an office. The managers will kill me if I forget. I think that's it. Did I say 12? It's all on our website actually. So
Yes, and I was gonna say
in
if
case I'm
anybody
missing, I don't want to miss anybody. They're going to be very mad at me. But
and also
yeah,
too,
that's
Dr.
pretty much
Zach,
all of our offices.
we'll leave all of the locations in the comments on this
Great,
as well to make sure
great,
everybody has access. And like
great,
you said too, they're all on the website.
great.
And then we also had a comment come through from Rhonda Lee. People with anxiety will love this, and I think that's absolutely true.
Well, so what we're doing, let me tell you, anxiety with adults is one thing, but imagine children. Children are anxious like crazy. My son used to come into our offices and cry. Okay, first thing before he'd get in the chair, he'd cry because he knew he'd get shots. And we've treated them conventionally before. We've given them injections. I personally treated them. It was just a nightmare when to treating your own child when he's upset. Yesterday's visit was just hilarious. I mean, he was just fun and he was just interacting with us. For children, it's a great experience. For adults, it's unbelievable. It's unbelievable for all people who are potentially afraid and uncomfortable with dentistry. Okay.
Yeah, that's
Also, it's very inexpensive to do this. It's much cheaper to doing this than waiting to get to stage 6 of this disease process and either lose the tooth, end up with an implant, or do a root canal in the crown, or do something like this. Is already, we're talking here thousands of dollars. This is extremely inexpensive.
mm-hmm. Yeah, and Dr. Zach, can you maybe talk through, like you mentioned the prevention of cavities and like other health issues. Can you talk through how you help your patients prevent future decay and how to preserve the teeth?
So what we are doing in our office is we're using SDF quite often. Okay, so if people are coming in and they have early onset of decay, what we call incipient decay, we do SDF. And then if it turns dark and the patients don't like it, and we pretty much know which fillings should be already treated with a smart filling and which areas we can just apply SDF and leave it alone. And so that's what we're doing with our patients. We also have, we are coming out with a membership plan where people are going to be able to reapply SDF. You remember how I said it has to be reapplied every 6 months?
Yes.
Well, our members will be able to reapply the SDF 6 months later at no cost, as long as they're members of the plan. So our goal is to get this out to as many people as possible and have them in prevention and have them away from doing drilling and have them away from doing root canals and just get them in the modality of prevention, remineralization, overall health of the teeth. If we can get that to happen, I think people are going to be like just teeth are going to be a great asset for people, not not a problem that people are concerned about. Something hurts and I have to deal with it. So the membership plan is there to help people get SDF done every 6 months. We also have, the Wellness 32 promise we have to our patients is we have quality assurance oversight. We see our patients every 6 months to make sure that the work we do is good and lasts, and constantly are monitoring the quality of our care. We also have in our practices a built-in second opinion to where once we do the virtual exams, the patient comes into our office and our clinical team has to check the exam and agree with the treatment. And then we have consensus of diagnosis. So we also always have two people agreeing on the treatment before we start with the treatment. And that's our system. I mean, the philosophy here is the patient is always first. We have an obligation to our patients to make sure they're healthy, that they go and they feel comfortable and they are comfortable to go to the dentist. Okay.
Absolutely. And
So
so,
if you're interested in finding out more about our membership plan, I believe it's on our website already, or it's coming on our website very soon.
yes, it will be coming. So definitely check back.
Okay.
And we have a few more questions. So I'm going to hit you with these. So, somebody asked, should I bring this up to my dentist when they recommend a filling? I'm worried that I may not be getting all of my options.
Absolutely, you should. Absolutely. 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 I would always, we always, we are the first thing we try to do when we examine our patients is see if we can do a smart filling first. Okay. If we feel we are too deep in this process, then we would recommend a more invasive approach. However, if we feel we can get away and still do non-invasive dentistry, where no drilling and no anesthetic is required, that would be our first option, always. So if you have that question, you should be asking. If you feel that that's something you're not getting the option of, you should be asking your dentist to look into it.
That sounds great. And we have one more question, Dr. Zach.
Sure.
So, is there anything I can get done on a consistent basis to preserve my teeth?
So yes, two things that happen in prevention. Okay, number one, if you have incipient decay, like early onset of decay, these stages here, SDF. Okay, number two, let's say the tooth is completely in good condition. Okay, but we constantly know, as one of the pictures I showed before, this picture here, this biofilm, the plaque. The plaque is the enemy. It sits on the tooth, emits acid, and causes cavitation, right? So there is always something happening, like this acids that's seeping through the enamel, okay? In order for us to constantly be protecting our teeth, we have to use fluorides all the time. Fluoride varnish, application of fluoride varnish several times a year professionally definitely strengthens and remineralizes the tooth. Doing this consistently over and over and over again is prevention. Obviously, excellent home care is important. Flossing is important. Brushing is important. But coming to your dentist and getting these professional applications of varnish and things like that are extremely important. And they will definitely protect and help remineralize the teeth. In fact, this is also part of our membership plan.
That's great. And Dr. Zach, too, those were all the questions we had. So before we wrap up, I didn't know if you had any closing thoughts, and then I can wrap us up.
Yeah, as I said before, I think if we partner up with our patients and think in terms of prevention, okay, which is the biggest thing in actually curing problems, preventing problems from happening first. If we can get ahead of the problem and deal with it early on, I think that will go a long way to creating a very happy patient, very happy children, very happy adults, and very happy older patients as well.
Absolutely. And you said that so eloquently.
Thank
So,
you.
Dr. Zach, thank you again so much for being here, putting this together, presenting this to everyone. For everybody who's tuning in, thank you so, so much for joining. We really hope you got some value out of this. And we will be sending out and doing a few more Facebook Lives over the coming months. So please check back on our page. We really look forward to seeing you. And as always, if you're interested in learning more about Zach Dental or any of our office locations, please visit our website, zacdental.com. And we're looking forward to any additional questions that you may have. So thank you guys so much.
Nice. Thank you very much for your time, everybody. It was wonderful to do this presentation for all of you. If you have any questions, please reach out.